Here with me now with information on their upcoming Food as Medicine Symposium are Beth and Purnima from the Buffalo Niagara Medical Campus. Welcome and thank you for being here.
Thank you.
All right, so Beth, let's hear more about the BNMC, what you do and what your mission is.
Yes, Buffalo Niagara Medical Campus is the innovation district in downtown Buffalo. We're all about making the community a better place for all. And a big part of that is actually health and well-being, which is what myself and Purnima do. And food as medicine is a major pillar of that. So we want the community to know that we're here as a resource for all things healthy living.
Yeah, so food really is medicine when it comes to preventative care, correct? So let's share more about why that's so important.
Yes, so we live in a country where it's normal to be sick and it's the exception to be healthy. So our goal is really to flip that and put the health span to match the lifespan. So the good quality years that we live match how long we live, and food as medicine is actually a big part of that. And there's a national growing movement to show that medically tailored meals, produce prescription programs, teaching kitchens actually can not only help to manage and prevent disease, but also it's treatable. We can reverse chronic disease, which is huge.
Absolutely. And how are you getting that message out there that food is medicine?
Our healthcare system right now is looking at a lot of different procedures and prescriptions, and so we're trying to ask the question, how can community food spaces like gardens and farms and restaurants and community centers help to improve health and wellness? And so next week we have our annual Food as Medicine Symposium coming up. It's our 5th annual. It's October 23rd, 24th, and 25th at the UB Jacobs School of Medicine.
Okay, wonderful. Purnima, let's share more about this symposium. There's a lot of good things that you're offering, and is it open to the community?
It is open to the community, and this is our 5th annual, like Beth just mentioned. We're super excited, and it's a 3-day symposium for the first time. And we have a slew of speakers, both nationally and internationally. We have 2 keynote speakers on Friday and Saturday. One of them is from Icaria, Greece, and he's going to be from the Blue Zones if you've watched the Netflix documentary. So we're really excited to have him speak. And we say that we don't have to live in a blue zone. We can live a blue zone lifestyle in Buffalo. So that's what we're hoping that we can all do. And at the symposium, there are going to be speakers talking about women's health. We have lifestyle medicine, where we address sleep, nutrition, physical health, social connections. We also have mindful movement and yoga both days in the morning before we start. We have chair massage all day, Friday and Saturday, so you're not just sitting and listening, so you can relax in between. We have food from Lloyd's that's going to be catered at the networking event at Groundwork Market Garden on Friday. So it's going to be a lot of fun. So please be there and don't miss out.
Sounds like a jam-packed weekend. How do people register? Can they just show up, or is there a registration that needs to happen?
There is a registration process. If you go to our website, bnmc.org/health and wellbeing, so you can get the tickets right there. You can be there for 1 day, 2 days, or all 3 days.
Wonderful. Why is it so important to have this symposium out there for the community to learn about the Blue Zone and different, you know, teachings like that?
Because you don't have to live in Italy or Japan or Greece to live a healthy lifestyle. Yes, we have cold weather most of the year in Buffalo, but that doesn't need to stop us. And I think, you know, quality of life is so important. We don't have to be sick or for the last 20 years of our life doing procedures and pills and all of that. And so the more we know, the more empowered we can be to take control and not feel helpless or alone is really important.
And can people come for all days, or just 1 day, or just half of a day? What do you recommend that people do for this symposium?
Well, ideally, we want them all 3 days, but we understand people are busy. So yeah, 1 day, half day, 2 days, or 3 days, everyone's welcome. But don't miss out on the culinary medicine demo that we have on Saturday, Chef Darian Bryan. We have a doctor from Boston, Alicia Lal, who is from Buffalo, actually. She's the only board-certified lifestyle medicine physician. And we also have a registered dietitian from the Boston Medical Center.
Wonderful.
They're going to be doing a demo, so don't miss out on that.
And talk about this year's theme, Beth, and what that is and how it sort of, you know, intertwines everything together.
So this is our 5th year. So we've been doing this for a while. It's not conversation anymore. This is about advancing action. So the results of previous symposiums, we've started the Western New York Food as Medicine Coalition. We have 400 members and over 180 organizations involved in that. We've started Buffalo Healthy Options Restaurant Week. We've gotten nutrition into the UB Jacobs School of Medicine education, and there's also a UB teaching kitchen coming soon where chefs and farmers, doctors and dietitians can all come together. So it's really about catalyzing action at this point.
All right, wonderful. Well, thank you again. And is the symposium free to attend, or are tickets needed?
It is a ticketed event. It's $150 for 3 days, but as I said, snacks, breakfast, lunch is all included in that. And we want to thank our sponsors, Univera Healthcare, TOPS, and UB.
All right, and good people like Chef Darian will be there, so, and Lloyd, so there's a lot of good names coming. So obviously encouraging those out there to be able to attend the symposium. Thank you for being here to you both. You can learn more about the symposium and get your tickets in advance by visiting bnmc.org and finding the Food is Medicine page under the Health and Well-Being drop-down. Thank you again.